most famous physical therapist on the internet.
Hi, folks. I'm Bob Schultz, physical therapist.
Brad Handheld, physical
Together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to go over the Bob and Brad shoulder pain stretching program. You should be doing this program along with the other video called The First Step You Must Take to Stop Shoulder Pain Permanently, 2 simple exercises. In that video, we're showing you how to improve your posture. And posture is such a big part of shoulder pain. But in addition to that, you're going to do these exercises. At any one time, you're only doing 2 exercises.
So we're going to give options of up to 5. You go through them, see which one your shoulder responds
Well,
best
it's
to.
a progression.
Okay.
Yeah, you start off with the one. The one we're going to have you keep doing.
Sure.
And then the others, as you do one, if it seems to be doing pretty well, equal to the other side, then you'll progress to the other one.
A little more aggressive.
A little more aggressive. And we'll go through all that.
Yep.
With all these exercises, we're going to have you do 10 reps.
10.
But the key to this is that you don't do it just once a day. You're doing it throughout the day.
For sure.
So a lot of times we recommend 6 to 8 times a day. And I can hear the yelling right now, Brad. Like, who thinks I can do this 6 to 8, 10 times a day? The thing is, this won't take that long.
1 to 2 minutes.
Yeah, 1 to 2 minutes. You got 2 exercises. And if you're serious about getting rid of your pain, that's how it's going to take.
Right. It's just a matter of, it's like anything in life. You just have to be consistent
put
with
in the
it.
work.
And things come along nicely.
All right. Also, we don't want you doing this exercise program if your shoulder is prone to dislocations or if you have severe osteoporosis. Now, what are the signs that this is working, Brad?
The exercises?
Yes.
When you start doing them, if the first 1 or 2 are a little uncomfortable or painful, but as you continue to do them, it feels better and better. Thumbs up. That's a good sign.
It might even centralize.
Right. Or like if the pain is running down your arm and it feels like it goes more to one spot, typically up here, it's a good sign. Also, when you first do it the first day, you may not want to do 6 times the first day.
Right. Very
Just
good
do
point.
it once or twice and see how it responds the next day when you get up. Sometimes it's overdone.
A delayed effect.
A delayed effect. You don't feel the soreness till the next day. So once you did this 2 days in a row and it's feeling good, that's when you ramp it up to that 6
You got
8
the green
times.
light then.
That's right. Exactly.
All right. Now you're going to need a booyah stick, or you're going to need a broom handle or some type of pole. What else would work, Brad? I don't know. Something.
Bob, if you got a piece of doweling, anything, it should be about 1 inch to 1.5 inches in diameter. Have something
good
you can
grip to it, yeah.
It's helpful if the ends have something that doesn't slip. If you're doing it on carpet, it doesn't matter, or a chair that has some cushion, because you're going to see the exercises. It needs to grip where it's positioned at the bottom. And this will all become clear as we show you.
All right, exercise number 1. We call it the Statue of Liberty, named by Brad. If you do hanging, which we are going to mention in a different video, if you're doing a hanging program, you can skip this one if you want. If you like it, though, if this one feels better than the hanging, do this.
Bob, I just read a comment this morning, or was it last night? Someone just thanked us. They said they got the book from Dr. Kirsch. They've been doing our hanging program as well as some of these, and they said it just changed their life. Because they were having shoulder problems. And it was like, that just
fantastic.
Nice to have the feedback.
Yeah. All right, so number 1, Statue of Liberty. You're going to go ahead and stick this on the chair. You're reaching, what you're going to do is reach up, work your way up as far as you can go with the arm. Now, for a lot of you, that may not be very far. That might be this far to start off with.
You could do this one on the floor.
Yeah, you could start off this way.
If you can't get up very high.
Exactly. That's the way you're going to want to start if you can't get up very high. You're going to work your way up. That's about it right there. Kind of hurts. And then you're going to start leaning forward. As you lean forward, you're basically trying to push the pole into the ground.
Yep.
What you're saying, Brad, you had a patient that went like this, right?
Well, yeah, I didn't emphasize that you have to grip the booyah stick, and he was sliding down. He thought that's what I meant. So he came in the next visit, and he was sliding down. I said, I'm sorry, I didn't make myself clear. You need to hold on to it, and that gives you the stretch, or what we call the flexion on the shoulder.
You're also trying to set the shoulder into the socket.
Right.
And that's why you need to push down.
Yeah. I tell my patients sometimes, imagine this is like a spear, and you're trying to push it into the floor. Obviously, it's not that, but that's the motion.
Yeah, if you were on a lake and you were fishing, like a frozen lake, you could try
Yeah.
to poke through the ice.
They do that with sturgeon.
Oh,
Yeah,
do they?
on Lake Winnebago, they cut a big hole in the ice and they spear sturgeon.
Oh,
It's
cool.
It's a way to fish up
So
there.
10 times of that. Now, the progression of this is you can actually work your way up, go a little bit higher. After you do a few repetitions, it might feel a little bit better, and you can maybe work your way up.
Yep.
Eventually, you may get all the way onto the chair,
Right.
which I need to do because I got fairly long arms, and I'm going to lean forward like this.
And if you don't need to reach higher, you may not need to go that level, depending
Right.
on your level of activity. When I called this the Statue of Liberty, I had a 13-year-old baseball thrower.
Sure.
He's a pitcher, and so he had to get really
Right,
good.
he had to
throw.
get motion.
So he was really stretching it out, and it worked so well for him. I thought that's cool, and
Right.
I said he looks like the Statue
Statue
of
of
Liberty.
Liberty.
So that's how it got started.
So that's the one this is one of the exercises you're going to keep doing.
Sure.
This is the one, the mainstay.
Stay. Yeah.
Okay, next one, shoulder extension. I think I'm going to go ahead and stand up for this
Yes,
one.
go
Brad.
ahead. So extension is back
Going back,
behind
yeah.
you.
So what you're going to do, you're going to grab with this is the involved shoulder, the painful shoulder, non-painful shoulder, palm going out, palm going in.
There you go.
And you're just going to gently work it going back like this. Keeping good posture, always good posture.
Take a deep breath and relax.
And you're going to go to the point where you feel some pain, like right here. Oh, it starts to pain. Back off.
We should call this the paddler, because it's just same motion you do when you paddle a canoe.
Well, I don't really want people going like this, though. I want them just going straight
Well,
back.
it's modified. The modified.
The
paddle.
modified
The
paddler.
sagittal paddling. The
Like,
sagittal
nice,
plane.
most people will know what sagittal is.
That's true.
So 10 of those. Now, let's say that one's going fairly well. Like it's almost similar to the other arm.
Right. So he's saying if you reach back with this arm, does this painful one go the same distance behind you?
Yeah.
Without doing this.
If that's happening at this point, then probably stop that one. You're still doing the Statue of Liberty. Now you're going to do shoulder internal rotation. What you're going to find with a lot of people with a painful shoulder, they won't be able to bring their arm up like this.
Right.
In fact, a lot of times they get like here, and that's about it. They can't go up the back like this. This is shoulder internal rotation.
So functionally, you need this to tuck your shirt in, get your wallet out. If you're wearing a brassiere, to buckle that up. So that's a really important motion.
Yeah, it is, and also just by improving this, it improves a lot of the other motions too. We always find
Exactly.
it. So you're going to take the stick, could be again a broomstick, and I'm going to bring it around my back like this. I'm going to grab onto it, and I'm just going to work my way up as pain allows.
So it's critical that you have the palm down
Oh
here
yeah, palm facing out,
facing out.
palm facing forward.
So the top hand, you would if you grabbed your hand with your palm, that's the proper way. And on the back side, the back of your hand is going to hit yourself in the buttocks. And then simply, I call this the back scratcher because, right, the booyah stick actually rubs on your back. And if your back does itch, it feels good. You
Yeah,
kinda-
actually, and this is where the booyah stick does work nice because it's so slippery.
Yeah.
It just slides up the back real easy.
Yeah. So if you're using something else, try to get something smooth, and you need to do this with a shirt on. I don't
Yeah.
think many people would do it with a shirt off, anyways. But
Now, after a while, again, let's say you're getting up fairly close to what the other one is doing. You're going to show again, Brad.
right.
what-
So if this is your good hand, you reach back, and I have my patients say with your thumb, go right up your spine and kind of mark that. Maybe get some help with someone that'll do it. And the other one, if it goes the same level, I've had people go higher with their sore one. And it's like, oh,
Yeah.
we're clearly ready
yeah,
to go.
we're better. We're better. So now the next variation is you're going to be in the same position, palm forward, palm back. I'm going to have the stick a little bit off to the side of my head so it doesn't hit my head. And what we're going to do is we're going to bring it up a little bit, and then we're actually going to bend it out a little bit, like this. Now,
Can you see that in the angle
yeah,
back? Okay.
you don't move your body.
Yeah.
A lot of people do that.
Yeah.
That's the one I find everybody does.
Think of it going past your ear.
Yeah,
I feel my ear getting
And again, gentle, no pain. We don't want any weird things happening with your shoulder doing this.
This one is one where,
It's a little more aggressive.
yeah, you need to be gentle
Yeah.
with it. No sharp pain whatsoever, just a gentle stretch. 10 repetitions, like Bob mentioned.
Now, once that is doing well, you're going to finish this last one here. And this one you can do in bed, certainly. I'm going to lay on the floor or lie on the floor. Have a say it right, Brad.
Well, we got to make sure our grammar is proper, Bob.
So-
we are professionals.
You're going to grab palms down, and you're going to work your way up like this as far as you could go. So let's say this, again, is my involved shoulder or painful
Sure.
shoulder. This one, the good shoulder, good arm, is going to help the bad shoulder.
Yep.
So I'm pushing it up a little bit. Sometimes the closer you have, the easier it is to do that.
Yep.
After a while, you could go further apart. But you want to get to the point where you're going all the way equal to the other one.
You know, and actually, Bob, I'm showing it against the wall as if I was laying on the floor. But as you get stronger, you
could do it absolutely.
on the wall, and then you have a good reference, and that helps your posture as you're standing.
That is the progression. You could go ahead and stand up and do it, because then you're going against gravity.
And you can, like I'm doing, I'm demonstrating. Actually, my left shoulder is a little tight. If I go out, I can more easily go up to the wall. As I get closer in, it's tighter. So I would progress from here and slowly get tight, closer together.
And once you hit that, milestone, you're probably ready for the strengthening program, which is the next video we're going to do.
Ah, good.
So
Good. Yep.
remember, go to Bob and Brad, go to the programs, and you'll see all the titles of the programs for shoulder pain. And make sure you subscribe to us too.
Absolutely.